American Cancer Society has a long and proud tradition as this nation's leader in the fight against cancer. More than a decade ago, the Society conducted its first nationwide Futuring Initiative, which led to the establishment of the nationwide 2015 Challenge Goals and nationwide priorities. Prior to that, the Society's work was mostly reactive to events, not forward-looking. With 2015 rapidly approaching, the Society is once again looking forward with its second Futuring Initiative. The intent is to ensure that the American Cancer Society is prepared to continue its leadership role in this fight and to address emerging issues.
This nationwide Futuring Initiative is designed to determine how the world will change by the year 2020 in terms of demographics, cancer trends, technology, healthcare, and determine what challenges and opportunities will present themselves.
This initiative has identified several trends, some very encouraging and others creating significant concern.
We're not yet sure how these trends will impact cancer patients in Florida, nor have we determined the Florida Division's role in addressing these trends. We do know that we have the capacity and ability to begin to implement strategies to address negative trends and take advantage of positive trends.
So, we are here today to talk with you about how the Florida Division can start looking forward to determine our future by launching a Futuring Initiative specific to our state.
A Florida-specific Futuring Initiative will build on the findings of the National Home Office, allowing us to gather the facts and examine the trends specific to this state so that we can develop our long-term strategies.
This initiative has the potential to transform our division so that we continue to have the greatest impact on cancer patients in our state. Let's take a look at why this Futuring Initiative is so important.
First, we need to examine the data and trends related to Florida's medical capacity. In 2007, the American Cancer Society launched a nationwide campaign to raise awareness about the need for quality, affordable health care for all Americans. There is clear evidence that lack of adequate health insurance leads to poor results for cancer patients.
A new groundbreaking report has substantiated this. The uninsured are less likely to receive recommended cancer screening tests, are more likely to be diagnosed with later stage disease, and have lower survival rates than those with private insurance. This is a vitally important issue for our nation and for our state. However, health insurance is not the only access issue we are facing.
Another critical issue coming out of the National Home Office Futuring Initiative is the impending shortage of medical care providers. By 2020, the nation will face an estimated shortage of 30,000 primary care physicians and 250,000 to 1 million nurses. Demand for oncology visits will exceed supply by 13 million.
Those numbers are staggering. While they are troubling on the national level, they are even more disturbing in Florida.
Florida ranks second in cancer incidence. The number of people diagnosed annually in Florida is projected to increase from 106,000 cases this year to 169,000 cases in 2020. Cancer deaths are projected to increase from 40 to 68,000 during this same period. Florida also has the greatest percentage of older citizens in the country and is growing by 1,000 new residents each day. Many of these new residents are of the age most impacted by cancer, further straining Florida's capacity.
What will it take for Florida to have the medical capacity to adequately serve cancer patients in the future? The truth is, we don't know enough about the shortage of medical professionals in this state to fully answer that question. But what we do know is disconcerting. A recent Florida State University study found that 13% of Florida's physicians plan to leave or significantly reduce their practice within the next 5 years.
The average age of doctors in Florida is 51, and 41% of them are over 55 years old. And it's not just physicians. Florida is facing a shortage of nurses, and all of the other ancillary services that our medical system can't do without, such as radiology, laboratory services, and physical and occupational therapy.
Added to all of this is the fact that the cost of cancer treatment will continue to rise. Today, 4 out of 10 cancer patients report skipping treatments, cutting pills, and avoiding filling prescriptions due to cost, all of which lead to poorer outcomes.
These aren't just issues for people who are uninsured. They're issues that affect all of us.
What can we do to prepare to address these issues? The state is beginning to look into them, and it is imperative that the Florida Division be involved to ensure that medical professions that are most important to cancer patients are considered.
For example, if the state seeks to provide more residency programs, which we know we need, the American Cancer Society needs to be at the table to ensure that the state includes those programs that are most critical to cancer patients.
Can the Florida Division have an impact on these issues? Absolutely. We believe it's our obligation.
The bottom line is, the Florida Division needs to determine how we can best provide leadership. Through this Futuring initiative, we'll gather the data we need to develop our long-term strategy.
Another important trend is survivorship. The number of cancer survivors in the United States has more than tripled to almost 10 million over the past 30 years. Thanks to advances in early detection and treatment, survival rates are increasing, but no one knows at what cost to the health and well-being of cancer survivors.
The good news is that by 2020, the survivor population nationwide will nearly double. In real numbers, we're estimating there will be 8 million more survivors than there are today. This news is very encouraging. It means we're saving lives.
We all know that technology is changing at a faster pace than ever before. It is truly changing the face of what a survivor looks like. Early detection technologies will help doctors predict risk and detect diseases at the molecular level. People will become cancer survivors before they even face what we consider the disease and cancer treatment.
Of course, we are ecstatic that we are reaching a place where the battle against cancer is won even before it gets started. So we need to look at how we may have to adjust our goals and communications to reach this new breed of survivors.
What will long-term survivors need from us in the future?
What programs and services can we afford to provide?
And how can we give survivors the opportunity to support our mission?
Finally, we need to look at trends affecting volunteerism. Our mission would be impossible to achieve without the volunteers that support the American Cancer Society on every level, more than 150,000 in Florida alone.
And we understand that there are a lot of causes and organizations wanting your time and support. Many new organizations, including cancer-specific groups, will intensify competition for dollars and will increase the need for organizational relevance, efficiency, and effectiveness.
Donors are increasingly adopting an investor perspective, as well as restricting their donations. We're seeing trends that show volunteerism becoming increasingly unpredictable.
A volunteer or donor may seem fully committed during one period of time and then move on to a different cause. They're demanding opportunities that complement their personal skills, interests, and lifestyles.
How we communicate with donors and volunteers is changing dramatically with new technologies. We have to look at new communication tools to engage them. How will the changing face of volunteerism impact the society?
How will the demographic trends change the Society's donor base in Florida?
These are major questions that will determine our future success. These are the kinds of questions we'll answer through this Futuring initiative. We need to ensure we continue to have the volunteers and donors necessary to achieve our goals.
The best organizations continually challenge themselves to think about what the future holds. Our goal isn't to make immediate changes, but to position ourselves for the future.
The American Cancer Society Florida Division enjoys a position of tremendous influence in this state. Together we can and we must use that influence to continue to address the needs of cancer patients in Florida. This Futuring initiative is the first step. It truly has the potential to transform the Florida Division.
Through all of this, we have one purpose: to ensure the Florida Division's ability to lead the fight against cancer in 2020 and beyond.